It's hard to really assess the situation here holistically because we don't have reliable information anymore. So we stick to analyzing big data. We do research on the ground. And from all what we know, Beijing is one of the first cities where the first big COVID wave happened. And, we've seen everything. We've seen overcrowded hospitals, funeral homes working at overcapacity, antigen tests being sold out, and, the city basically being a ghost town. But since 1 or 2 days, it is changing. The subways filling up again, and even some restaurants are crowded again. Why? Because the number of people who have been recovered in the last days is growing really also very rapidly. In Shanghai, the really rapid increase of cases is just starting now, and they try to have some mitigation efforts. For example, they will now send all the students back to online classes in an effort to slow down the spread of the virus.
Meanwhile, the country's chief epidemiologist saying there are set to be 3 waves of the virus over the coming months.
Yes, the first wave we are basically seeing now that's affecting mostly the urban centers, the big cities at the East Coast, Beijing, Shanghai, Shenzhen. And the second wave will be later in mid-January when there will be the Lunar New Year, and hundreds of millions of Chinese will be traveling to their hometowns, to their families. And they will bring the virus with them, of course, to every corner of the country. This is the second wave. And the third wave that is predicted will be then lasting until early March when people go back to office and then, of course, bring back the virus to the cities again. So this all shows that the pandemic winter here in China will be a long one, and it's not over yet. And of course, it can be especially harsh for the areas that don't have such a developed medical system, like here, for example, in Shanghai or Beijing. In some other areas in the countryside, of course, it's much more rudimentary.